Very much, Mr. Chairman. Later today, we're going to vote on the Oz nomination. I'm just going to spend a few minutes describing why I can't support the nomination. During his confirmation hearing, Dr. Oz was given the chance to assure the American people that he would not be a rubber stamp for Republican plans to gut Medicaid and hike Affordable Care Act premiums. At every turn, he failed the test. When I asked him a yes or no question about whether he would protect Medicaid, he dodged, he weaved, he simply wouldn't answer. That's a stark contrast to what I heard at town hall meetings, open to all, in Oregon the past week. In Oregon City, I was joined by Patty and Katina, a mom and a daughter who count on Medicaid to help with Katina's medical expenses. Because of Medicaid, Katina can thrive in the community as an Oregonian who lives with Down syndrome. There are countless other families in Oregon and across the country who are terrified of these cuts. Dr. Oz also ducked a number of my other questions. When pressed on whether nurses belong in nursing homes, he replied, "That was a complicated question." I just found that a jaw dropper. It isn't complicated for the rest of us whether nursing homes ought to have adequate staff to take your mom to the bathroom or give your grandpa meals. I told Dr. Oz it was pretty simple. Not only did the nominee dodge and weave during questioning at his confirmation hearing, he also failed to provide factual responses to our written questions submitted after the hearing. This lack of responsiveness to Congress ought to be unacceptable to every member of our committee. But the Republican majority once again seems eager to disregard their own congressional oversight responsibilities when Donald Trump calls the shots. I'll once again state that Dr. Oz is the second Trump nominee to come before this committee with a record of dodging Medicare and Social Security taxes. Nurses and firefighters across America pay taxes with every single hard-earned paycheck, but the multimillionaire nominated to run Medicare can't be bothered to do the same thing. Chairman, this is a continuation of our efforts to spotlight healthcare middlemen that, in my view, are leeching off the healthcare system at the expense of taxpayers and seniors. Our investigation found that too many for-profit insurance companies are spending billions of taxpayer dollars on marketing middlemen to drown seniors in calls and mailers. These tactics are designed to pressure them into enrolling in private health plans that might not even cover their preferred doctor or medicines, or that may put up unexpected roadblocks to getting the care they need. Insurance companies and these marketing middlemen have orchestrated a complex and complicated system to line the pockets of shareholders by raising costs for seniors and taxpayers and evading oversight and accountability. Given Dr. Oz's history of basically acting as a salesman for Medicare Advantage, putting him in charge of regulating these middlemen is almost like letting the fox guard the proverbial henhouse. The bottom line is that American tax dollars are in too many instances being used for profit insurance companies for shady marketing practices that take advantage of older people. For-profit insurance companies spend 5 times more on marketing and administrative expenses than traditional Medicare, which is, of course, run by the government. If Elon Musk and his cronies at Doge actually cared about targeting waste and fraud, they'd be focused on waste and Medicare Advantage rather than targeting Americans' hard-earned Social Security. We've successfully fought for more consumer protections against predatory MA marketing, and I asked Dr. Oz to pledge not to roll those protections back. He may be open to our concerns on that, and if he's confirmed, I'm going to hold him to that and watchdog this issue, spotlighting abuses. But the bottom line, colleagues, is that this is a nominee who has shown no ability to or interest in pushing back on the dangerous Trump healthcare agenda. I urge my colleagues to vote no.